This is the collateral knee tape. You're going to begin by putting 2 anchor strips over the middle of the thigh and 2 anchor strips over the middle of the lower leg. Then you will place a strip from the lateral lower leg to the medial thigh, going over the kneecap. Then you will place a strip from the medial lower leg to the lateral thigh, again going over the kneecap. We will do another strip going from the lateral lower leg to the medial thigh, this time passing under the patella. We'll place a strip from the lower leg medial side to the lateral thigh, again passing under the patella. Then on the lateral side, we will place a strip going from distal to proximal straight up the leg. Then we will do the same thing on the medial side, again going from distal to proximal straight up the leg. Then we will close our wrap. This is the hyperextension knee tape. You're going to begin with 2 anchors around the mid-thigh. And then you will place 2 anchors around the middle of the lower leg. Then we will use 3-inch elasticon tape, applying a strip from the middle of the posterior lower leg to the posterior middle thigh. Then you will place a strip beginning on the medial side of the lower leg and continuing to the lateral side. We'll do the same thing, but going from the lateral side of the lower leg to the medial side of the thigh. Then we will apply a few circular closure patterns around the thigh and the lower leg. This is the patellar tendon strap. You can begin by applying a few layers of pre-wrap if desired. Then we apply 1-inch tensoplast into the mid portion of the patellar tendon between the inferior pole of the patella and the tibial tuberosity, being sure not to go completely around enclosing the strip. We will repeat this 1 more time, 2 more times if desired. This is the McConnell taping for the maltracking of the patella. In this video, we will be preventing the lateral movement of the patella. So we will begin on the lateral side, pulling medially over the center of the patella and continuing with a strip on the underside and then following with a strip above. This is the knee compression wrap. We will begin with applying the wrap to the proximal lower leg and wrapping from distal to proximal. We will apply the wrap in a spiral pattern overlapping by half the width of the wrap. We will finish the wrap over the mid-thigh and then we will use power flex to anchor the wrap. This is the hip pointer wrap. We will begin by placing the pad over the injured area, and then we will take our wrap and begin to wrap around, applying mild to moderate roll tension. Then we will anchor the wrap with 3-inch power flex, wrapping in the same manner that we wrapped with the wrap. This is a thigh compression wrap used to control swelling. We will begin with the anchor around the distal thigh directly on the skin and encircle the anchor, continuing to apply the wrap in a spiral pattern from distal to proximal, overlapping the wrap by half of its width. We will finish the wrap over the proximal thigh and anchor with power flex. This is the adductor strain wrap. We will begin by applying the wrap at the lateral distal thigh directly onto the skin. We will continue to apply the wrap in a lateral to medial circular pattern. Once at the proximal thigh, we will continue across the lateral hip and waist. We will continue to apply the wrap distally across the proximal thigh with a downward pull. We will repeat this pattern once more. Then we will close off the wrap using the same technique.